This is Healthcare Now Radio's Interviews Now. Thank you for joining us. I'm Roberta Mullin, today's host, and I'm joining you from HIMSS 18 in Las Vegas. Follow our show's hashtag InterviewsNOW and join the conversation. In this fast-paced, ever-changing landscape we call healthcare delivery, who can we trust to tell us, good or bad, what is happening now? Let us help you sort out these issues with today's thought leaders in the know. On this episode, we'll be discussing the WEDI organization with the President and CEO, Charles Steller. WEDI is the work group for electronic data exchange. Thank you for joining me today, Charles.
Thank you, Roberta, and it's a pleasure to be here. It's a pleasure to talk about the WEDI, the Work Group for Electronic Data Interchange. And just to give you a little bit about our history, if I could.
Sure.
What I want to do is make sure that we, the history and where our membership and where we are and where we're going is a very important part of what I would like to share today. WEDI has a deep history and a rich history as an entity that was formed really through in the mid-90s and was included in the HIPAA regulations as an advisor to the Secretary of Health and Human Services, as well as having an advisory role with NCVHS and other entities within HHS. So as it was actually formed by Secretary Louis Sullivan, and Dr. Sullivan felt that as healthcare was, we thought, changing then, we certainly felt that this was a great opportunity for us to deal with some of the administrative simplification pieces, some of the connectivity pieces, interoperability pieces, some of the things that we at that time realized that were not exactly working, and felt that bringing the private public partners as together would help us immensely with getting everyone at the table, everyone talking about the issues in a safe setting where they are encouraged to collectively come up with recommendations that hopefully will make a difference with the rollout of certain products. Certainly that was true with HIPAA, and probably the other one that was quite notable in WEDI's history is the implementation of ICD-10. ICD-10 was obviously a challenge for all involved in terms of the cost to bring it together, and certainly the implementation, while it was delayed for years and years, finally it went off without a hitch as such. And while I don't believe that we have been able to really look at the research, have enough data for the research, at least this is the ICD-10 is giving the all of us, the payers, the providers, the patients, some information specific on diseases and diagnosis. So WEDI provided us an important role in the making sure that people were prepared for and ready to with the tools and the toolkits and the toolboxes for implementation. And this was done successfully at the rollout of ICD-10. The organization is, as I said earlier, composed of the payers, and that includes, for example, just to name a few, we have most of the Blue Cross Blue Shield organizations, and we have also the Blue Cross Blue Shield Association as part of our membership. We have non-Blues, Aetna, Cigna, Humana, Anthem, which is part of the Blues, but we have a lot of the major and regional and national players when it comes to health plans, including AHIP as well. When we have providers, we have all the Mayo Clinics and Cleveland's, and it's so important to have that perspective and to bring the two together. So Montefiore and Intermountain and so on. So we have those, and as well as CMS, and CMS is at the table. And we also have vendors, those people who are out there in the field trying to implement everything. That includes our membership, that sort of represents our board as well. American Dental Association, American Medical Association, so we have everyone together to try and come up with the issues, the solutions.
So personally, how long have you been involved in WEDI, and what have been your roles?
Sure. I joined WEDI in an interim position in January of 2016. And later on, a couple months later, in my interim position, they said, would you like to do this full time? And I did. And so I've been the president and CEO officially since May of 2016.
But you were involved with WEDI before that, or not?
I was.
Yes.
I was.
Okay.
So it was, the good thing is, from the inception of WEDI, as one of the organizations, I used to be with the payer organization called AHIP.
Okay.
So with all the payers, and we had a board seat, and we were there during the early days of WEDI. We had a board seat. I knew the people was involved sort of as not on the board, but certainly knew all about the works of WEDI.
Okay. All right. That's great. Well, as an organization, of course, one of the big things is you have initiatives. You have everybody in the gambit of this entire industry,
right,
in your organization. So what are your big initiatives that you're working on this year, 2018? What's to highlight?
Sure. One of the ones that we prior authorization is such a big one, and it's one that we may have. Last year at this time we formed a prior authorization council, and we brought all of the players together to really do more of an inventory of exactly what the prior authorization programs and what some of the issues were, and some of the principles, looking at programs, trying to get a feel for where is there overlap and where are there opportunities for us to do some maybe corrective action.
Mm-hmm. Can you share some of those with us?
Certainly.
Okay.
And one of the things that we recognize, there's certainly the pain points between providers and payers to say, and yet when you look at it, you go, it's sort of, while we don't have necessarily all of the answers, the recognition is, wouldn't it be, to publish all of your guidelines and principles and criteria is something that probably isn't possible, or at least one would, I don't believe people would volunteer to do that. And certainly on the provider side, it's frustrating to say, well, I'll just send you everything up front, because that way you'll never have a question. But I think the issue is trying to reach the balance. And you see the frustration, you see what, and hear a lot about it from our members from the provider perspective, and what they go through to get things approved. So what we're learning is there may not be an opportunity to do a black box, or if there is an opportunity, it should include some of the principles we've already heard about from the Google exec yesterday.
Right.
And he's saying, let's there's some artificial intelligence, there's other items that can help us. There are ways that we can mix the having information, having the guidelines in a structure that can be checked against what people are asking for, what providers are asking for, so that the most important thing is not for care to be delayed. And what we want to do is that's the patient, and the patient says, I don't want it, and so neither does the provider. So it's again to reach that sort of happy medium of having the information, being able to make decisions, and so that we do not delay care.
So prior authorization, it's probably been a challenge since, the beginning of insurance, right?
The beginning of time, probably.
Who's paying for this,
right?
The bottom line is, who is paying for this? Okay, so now you have, it sounds like you were saying the challenge a lot of times is between the provider and the insurer and the payer. Like, okay, so the connection there. So is the solution going to come from the vendors of software? Is it going to come from outside? Is blockchain going to be? I mean, if I hear blockchain, it seems like the answer to a lot of these things. I mean, are these some of the solutions to this, and that's what people are looking at?
Yes.
Okay.
I mean, I think that whether it's blockchain, whether it's fire, there's whatever we can do to organize the criteria and the rules and the questions that are being asked in order to make decisions. If we can organize those in a way and make it as easy as possible, so that only those that don't meet certain high-level criteria have to be delayed and have to be looked at further. So I think there's an opportunity for a lot of this technology, if you call it the technology, to help us in this process. So part of it is understanding each other and making sure that we understand the pain points.
Correct.
And secondly is, how do we correct it? And correcting it, I think at this point is, there's no need to be pointing fingers. I think that it's now time for us to sort of figure out what are the ways that we can make this, using all of the points that Mr. Schultz made from Google, is, what are is there artificial intelligence that's possible? Is it big data that can help us out? Is it clarifying any technology snafus or challenges? Let's figure that out. And let's also look at how we can use some of this new technology to address an old issue that has been nagging us for a long time. If you're just joining us, I'm talking to Charles Stellar. He's the president and CEO of WEDI. That's the Work Group for Electronic Data Interchange. Again, thanks for joining me here. And it's a very special episode because we are actually at HIMSS 18 in Las Vegas. And I think I would be remiss to, it's only the first day, but what do you think the vibe is here? It's truly exciting. Whether the number you hear is 43,000, whether someone else said 80-some thousand, and whatever the number is. Including spouses and children that they've dragged along. Whatever it is, I keep writing back to certain people saying, I'm sorry I couldn't take your call, but I'm here with 44,000 of my closest friends. Right. It's an amazing place, the event. There's some fantastic speakers lined up. I've already been to several sessions, and the exhibit hall is almost overwhelming. There's so much content there. There's so many people that are there with their solutions. So you go into the exhibit hall and say, what is my problem, and where might my solutions be? And, again, I look at it from the perspective of, some of the issues that WEDI's trying to addressing with our work groups, and it's a very special time to sort of look at what are the ways that we can improve. The Google executive mentioned again cloud and cloud computing and privacy and security and being able to exchange information. And again, that's an important part. And there's a whole section in the exhibit hall about, with cloud computing companies. And so every aspect is addressed here at HIMSS. Yeah, they've done a very good job in the last few years, I think, about Keynote speakers. They really have brought in some big people that have
had solutions in other areas and success in other areas. So that
and very practical. And
yes.
that's where you turn to someone who's had an unbelievable success record, with Google and Alphabet, and
exactly.
again he's saying healthcare is behind the curve. And so you're listening to,
and he's not telling anything we don't know. I don't believe that.
So now it's just for us to figure out exactly how we can do something with that.
That's right.
And some of the other things that have been a bit of a nag for years is again attachments. Something that you say, well, why is it such a big deal? Well, we've been trying to sort of figure out exactly how do people communicate, how do the physicians communicate with the payers and payers back to the physicians, and how do you send information from doctor to doctor, hospital to hospital. What is the attachment? Is it a PDF? If it's a structured PDF, is it an unstructured PDF? How do we transmit in a safe and secure manner? And what is the ways that we would be able to do it, which would be all of the careful consideration for privacy and security. So we've tried looking at all of the regulations around attachments. We have a work group that's been extremely busy looking at all of the issues. We are hopefully in the final stages with CMS being able to announce the next steps with attachments.
Yeah, so that goes along with the interoperability, and they have a showcase here downstairs, and I spent a good hour down there this morning, and they have all the latest stuff, and they have everybody together and everything. And there was one area that they were showing a patient going through. They had I think 12 different systems from 12 different companies, and they all had their systems going. And the patient started at the beginning and told all the person all the information, and then they showed each of the going down the way that
scale,
they could just pull it up. The patient didn't have to tell him anything because he knew it all from the first one. So they were showing that interoperability, which was kind of interesting. And the person said, "Well, get closer so you can see what's going on." And I said, "Well, my healthcare is done through Emory in Atlanta, and they use Cerner and all of these people. And I was just recently at 3 different places in the course of 6 weeks, and I didn't have to say anything."
Yeah.
My records were there. They're already interoperable. So that the way it goes and everything else, it's happening. It's happening.
It's happening,
yeah.
And the systems are there. And what we're challenged with is trying to do some huge turnover of systems. If you're converting a system to
legacy
Cerner
systems out there,
whatever.
Legacy systems are a real problem out there.
And what we have done in order to, what hospitals have done in order to deal with various issues, their cardiology area would develop their own system. And because the system that they were using in that hospital wasn't strong enough, it didn't have the umph. Same thing as radiology. So now you have someone trying to implement a new turnover system, and they have to take each of those components and try and bring in some legacy systems and some special modifications that were made years ago. They can't lose that information. So what we want to do is, I just find interesting is in my case in Washington D.C., I have my records that reside with my internist, my cardiologist, with all these specialty physicians, and yet they're in these portals, and I cannot make them sing together. We have
the one record, the universal record.
Right.
So
I'm, again, we're challenged just like other patients are to say, well, how can I get information back and forth? Fax it, and I have to say, but I don't even have a fax machine anymore. And so then you resort to downloading printing out, copying, and sending it to 5 of your doctors.
Right.
So they'll have all your recent lab tests. So again, that's inefficient. It also is someone who, like myself, who really wants to have a coordinated system. And I've decided to be my own coordinator and to be my own sort of record keeper.
Right.
So what I can do, and what I'm hoping we will be able to do, is we will have a system like Emory for everyone.
Right.
And we'll be able to, whether you are going from Emory to another system in DC, no problem.
Right, no problem.
We can handle you on vacation when you come visit the nation's
Pharma
capital.
does it.
Yeah.
If you get
Very simple.
CVS, it doesn't matter where you are.
That's it. Pharma does it, and so do the banks. You can get your money out of ATMs anywhere in the world.
Exactly. So we're at HIMSS. It's a big conference, but WEDI has annual conferences, and you've got one coming up. Tell us a little about what about your conferences? Like, who should go? Like, what are you doing? What's next one?
Sure. Our conference, our next one's in May in Scottsdale, Arizona, May 21st.
And I think you do a golf thing there too, right?
No, we don't do a golf. We have done that.
Yeah, you have done.
We have done golf.
Okay.
This time we're not. We're keeping everyone in the sessions so they can enjoy all of the content.
Right.
We may give them some breaks, but again, what we did is with our education committee, they've been looking at all of the topics that have come out of the work of our work groups. So again, we're looking at attachments. We are looking further at prior authorization. We are looking at claims, and we're looking at payment models. We're looking at cloud computing. We're looking at the Medicare card and the change of a Medicare number, and that goes in April 1st.
That's right.
And we had some sessions in December at our conference, and we have decided that even though I think CMS has done a really good job of trying to get the word out, there's going to be some confusion, we believe, with some of the surveys we've done, that maybe everyone's not going to be ready. Whether it's the individual physicians.
What does it take to be ready? What does it take? Like, what would be one of the challenges?
Let's just say that, so I walk in with my old Medicare card,
Gotcha.
which has my Social Security number plus
Something.
a T or something. And I've been mailed a new Medicare card. A new number has been issued to me. And it all depends on when I go into my physician's office or hospital or whatever it might be. So what we are challenged with is how do you go from one number to the other? How do you put both numbers on the claim? How do you do lookup of your old and your new? What about if you have only the old and you can't find the new? And everyone doing lookup is while I think that CMS is, as I said, I think done an admirable job. We're still concerned that there's going to be confusion there. There's been confusion. We've heard, as you know, we're trying to get the message out. Protect your Medicare number because it is your Social Security number.
Right.
And, don't give it to anyone. Then we're also seeing, oh my gosh, patients are going to say, the physician's office is going to say, well, show me your new Medicare number. And they're going to say, no, I'm not supposed to show it to anyone.
Correct.
So we have just that little bit of confusion and concern. So we believe that.
And billing, you don't want to stop any. You don't want to stop any cash flow. Right.
So
Medicare's a big cash flow.
Big cash flow. So there's the individual practicing physician. There's all of the hospitals. There's all of the issues that we can address. And so what we're doing is we've had listening sessions. We've brought in the people that are affected by this, AARP, and representatives from all of the various groups to say, are we ready?
Yeah.
And, there are health plans that are, staffing up for additional customer service calls. There are people that are just expecting a lot of questions. We may be surprised. There may not be any, but we know what it's like in a lot of the other integrations and changes.
Right.
And so we are hoping that we certainly do not want the Medicare population to suffer, so we're doing at WEDI, trying to find what areas and problems may exist that we can help address.
Well, one of the things that I see as a reoccurring theme in everything that we've talked about in your history of this is that the organization is always willing to bring all the stakeholders to the table for at least to say their side of things, and that you take that all into consideration.
That's absolutely true. And
That's
one
great.
of the things that we find that WEDI's role is a facilitator, bringing people together, a convener, bringing again people together to talk about the issues and to figure out some solutions and to do what we can to get that educational aspect out.
And how can people find you on the web?
www.wedi.org.
WEDI.org. That's WEDI.org. www.
Exactly.
So learn more about WEDI and what they're doing in the healthcare and healthcare IT space at WEDI.org. And thank you for tuning in today. For more information about Interviews Now, visit our show's program page on healthcarenowradio.com. And until next time, if it's happening in healthcare and it's now, it's on Interviews Now.